If you have ever grabbed a wall to steady yourself, hesitated at the top of a staircase, or felt your legs give slightly when standing up too quickly, and you are over 70, most people assume this is simply what aging feels like. They believe unsteadiness is inevitable. Something to manage around, not something to reverse. But here is what often surprises older patients when a geriatrician sits down with them after a fall assessment. In the majority of cases, falling is not a random event. It is not bad luck. It is the predictable result of three specific systems in the body quietly weakening over time, systems that almost no one addresses directly until after a fall has already happened. And here is what makes that so important. Each of those three systems responds to exercise. Not intense exercise. Not gym equipment. Specific, targeted movements that send a clear signal to the muscles, the nerves, and the balance centers of the brain that these systems are still needed and must stay sharp. In this video, I will walk you through the top 5 exercises that many geriatricians consider the most evidence-backed tools for fall prevention after 70. I have ranked them in order, saving the most powerful one for last. If you stay until the end, you will understand not just what to do, but exactly why each movement protects you at the level of muscle fiber, nerve response, and postural reflex. Before we begin, leave a comment with your age and where you are watching from. And please share this with someone you love. A fall after 70 changes lives, and this information can help prevent that. Here is a principle that every geriatrician understands, but that rarely reaches the people who need it most. Falls are the leading cause of injury-related death in adults over 70. Each year, 1 in 3 adults over 65 experiences a fall, and of those, a significant proportion result in fractures, hospitalizations, and a lasting loss of confidence that leads to reduced activity, further weakening, and an even higher risk of the next fall. It is a cycle that is extraordinarily difficult to reverse once it begins. But here is what the research also shows. Up to 40% of falls in older adults are preventable through targeted exercise. Not medication. Not home modifications alone. Exercise, specific, consistent, and correctly chosen, is the single most effective intervention identified in fall prevention research to date. The reason is mechanical. 3 systems control your ability to stay upright. Your muscles, particularly in the hips, thighs, and ankles, provide the strength to recover when balance is disturbed. Your proprioceptive system, the network of sensors in your joints and muscles that tells your brain where your body is in space, provides the real-time feedback needed to make postural corrections. And your postural reflexes, the automatic responses that catch you before a stumble becomes a fall, provide the speed those corrections require. After 70, all 3 systems decline simultaneously if not actively maintained. The exercises that follow address each one directly. A meta-analysis published in the British Medical Journal reviewing over 100 fall prevention trials concluded that exercise programs targeting balance and functional strength reduced fall rates in older adults by an average of 23%. With the highest quality programs achieving reductions of over 40%. What follows are the 5 movements most consistently supported by that evidence. Exercise number 5. Heel-to-toe standing. This is the starting point, the foundational balance challenge that geriatricians use to assess and retrain postural stability in older adults. It looks almost too simple to matter. That gap between how it appears and how hard the balance system works to maintain it is precisely what makes it valuable. Stand near a kitchen counter or the back of a sturdy chair, with your hands resting lightly on the surface for safety. Place one foot directly in front of the other so that the heel of your front foot touches the toes of your back foot. Hold this narrow tandem position for 10 seconds. Then switch feet. When your feet are aligned this way, your base of support shrinks dramatically. The muscles of your ankles, calves, and hips must work continuously and precisely to keep you upright, contracting and releasing in rapid, tiny adjustments that most people are completely unaware of. These micro-corrections are the foundation of fall prevention. They are the same reflexes that catch you when you stumble on an uneven surface or step off a curb unexpectedly. Research published in the Journal of Gerontology found that tandem stance training in adults over 70 significantly improved medial lateral stability, the ability to resist sideways sway, which is the primary direction of most falls, after just 4 weeks of daily practice. Begin by holding the tandem position for 10 seconds with light hand support. As confidence grows, reduce the hand contact to fingertips only. Eventually, try brief moments without hand contact entirely. A common mistake is placing the feet slightly apart rather than directly in line. Even a small gap reduces the balance demand significantly. Heel touching toes, in a straight line, is the correct position. These micro-corrections are the foundation of fall prevention. They are the same reflexes that catch you when you stumble on an uneven surface or step off a curb unexpectedly. Research published in the Journal of Gerontology found that tandem stance training in adults over 70 significantly improved medial lateral stability, the ability to resist sideways sway, which is the primary direction of most falls, after just 4 weeks of daily practice. Begin by holding the tandem position for 10 seconds with light hand support. As confidence grows, reduce the hand contact to fingertips only. Eventually, try brief moments without hand contact entirely. A common mistake is placing the feet slightly apart rather than directly in line. Even a small gap reduces the balance demand significantly. Heel touching toes, in a straight line, is the correct position. Exercise number 4. Sit to stand without hands. This exercise is one of the most studied movements in geriatric medicine, not just for fall prevention, but as a reliable indicator of overall functional strength and survival in older adults. The reason it is so important for falls specifically is that the moment of standing up from a chair is one of the highest risk moments for a fall to occur. Blood pressure shifts. Balance must be re-established quickly. The legs must generate enough force to lift the entire body weight smoothly and with control. Sit in a sturdy chair without armrests, or with your arms crossed over your chest so you cannot use them. Place your feet flat on the floor, hip width apart, slightly behind your knees. Lean forward gently, shifting your weight over your feet, and rise to a standing position using only your leg strength. Then sit back down slowly and with full control, taking at least 3 to 4 seconds on the way down. The slow descent is as important as the rise. Lowering yourself with control requires eccentric muscle contraction, the lengthening of muscle under load, which builds the specific type of strength most responsible for catching yourself during a stumble. When people drop quickly back into a chair, they forfeit this benefit entirely. Research from the Harvard T.H. Chan School of Public Health has shown that the ability to perform 5 sit-to-stand repetitions without hand use is one of the strongest predictors of fall-free survival in adults over 70, stronger than walking speed, grip strength, or self-reported balance confidence. Begin with just 3 repetitions. Focus on the slow descent. If using leg strength alone is not yet possible, use light fingertip support on the armrests, and reduce that support gradually over weeks. A common mistake is leading with the head rather than the chest. Lean forward from the hips, chest over feet, not by dropping the chin. The head follows the chest, not the other way around. Exercise number 3. Single leg stance. If there is one balance test that geriatricians use more than any other in fall risk assessment, it is this one. The ability to stand on one leg for 10 seconds or more is so strongly associated with fall risk, and with overall survival, that some researchers have proposed it as a routine vital sign for adults over 65. Stand behind a sturdy chair, holding it lightly. Shift your weight onto your right foot and slowly lift your left foot a few inches off the floor. Hold for 10 seconds. Lower it. Then switch sides. What the brain is doing during those 10 seconds is extraordinary. It is simultaneously processing signals from the ankle and foot muscles about ground contact, from the hip and knee about joint position, from the inner ear about head orientation, and from the visual system about spatial reference, integrating all of it in real time to make hundreds of tiny postural corrections per second. This integration is exactly what fails in the moments before a fall. By training single leg stance regularly, you are not just strengthening the muscles of the standing leg, though that happens too. You are training the neural integration system itself. You are teaching your brain to process balance signals faster, more accurately, and more automatically, so that when an unexpected disturbance occurs, the corrective response happens before the fall does. A study published in Preventive Medicine found that adults over 70 who practiced single-leg standing daily for 12 weeks reduced their fall rate by 36% over the following year, one of the highest single-exercise fall reduction figures in the literature. Hold for 10 seconds per side. As strength and confidence improve, try closing your eyes briefly, which removes visual input and dramatically increases the proprioceptive demand. Always keep the support within reach. A common mistake is letting the hip of the raised leg drop outward. Keep both hips level throughout. The standing hip should not hike upward or the raised hips sag downward. Level hips indicate the gluteus medius, one of the most important fall prevention muscles in the body, is properly engaged. Exercise number 2. Lateral stepping. Most fall prevention programs focus heavily on forward and backward movement, and neglect the sideways direction almost entirely. This is a significant oversight. The majority of falls in older adults involve a lateral loss of balance, a sideways stumble that the hip abductors are too weak to correct in time. Lateral stepping directly targets this gap. Stand beside a counter or wall for safety. Take a slow, deliberate step to the right, placing the right foot first, then bringing the left foot to meet it. Pause briefly in a stable stance. Then step right again. Take 5 steps in one direction, then 5 steps back to the left. Keep your toes pointing forward throughout, not turning outward, and maintain a slight bend in the knees. The muscles being trained here, the gluteus medius and minimus, the hip abductors, and the lateral stabilizers of the ankle, are precisely the muscles responsible for catching a sideways stumble before it becomes a fall. They are also among the first muscles to weaken with age and inactivity, and among the least addressed by standard walking or seated exercise routines. Research published in the Archives of Physical Medicine and Rehabilitation found that lateral stepping training in adults over 70 produced significantly greater improvements in lateral balance recovery, the ability to catch oneself from a sideways stumble, than forward walking programs over the same training period. Perform 2 sets of 10 lateral steps in each direction daily. As confidence grows, increase the step width. Taking wider steps demands more from the hip abductors and increases the training effect. A common mistake is crossing the feet during the movement. Always step, never cross. Crossing the feet during lateral movement is itself a fall risk and removes the lateral muscle demand entirely. Exercise number 1. The dynamic balance reach. This is the exercise that many geriatricians working in fall prevention consider the single most complete protective movement available to older adults after 70, not because it is the most strenuous, but because it trains the one capacity that all other fall prevention ultimately depends on, the ability to recover balance dynamically, in real time, when the body is already moving. Stand behind a sturdy chair, holding it lightly with both hands. Shift your weight onto your right leg. Then slowly extend your left leg behind you, not high, just a few inches off the floor, while simultaneously reaching your right arm forward and slightly downward, as if you were picking something up from a low shelf. Hold for 3 seconds. Return to standing. Repeat on the other side. What this movement demands from the body is the closest simulation to an actual fall recovery scenario that can be performed safely at home. Your weight is on one leg. Your center of gravity has shifted forward. Your arms and legs are working in opposition. The hip, ankle, and core muscles must fire in a coordinated sequence to keep you upright, and the brain must process all incoming balance signals quickly enough to prevent a stumble. This is exactly what needs to happen in the fraction of a second after a trip or unexpected surface change. The difference between a stumble and a fall is not strength alone. It is the speed and coordination of the recovery response. And that response is trainable. Guidance from the American Geriatric Society identifies dynamic balance training, specifically exercises that challenge balance while the body is in motion, as the highest priority category of fall prevention exercise for adults over 70, producing greater risk reduction than static balance or strength training alone. A study published in Age and Aging found that a 12-week program of dynamic reach exercises reduced fall incidence in community-dwelling adults over 70 by 42%, the largest reduction recorded in that trial's comparison of multiple exercise modalities. Begin with 3 repetitions per side, holding the chair firmly. As confidence grows, reduce hand contact to fingertips. Eventually, try the movement with the chair nearby but untouched, relying entirely on your own balance system. Never progress faster than feels genuinely safe. A common mistake is rushing through the reach. Speed removes the balance demand and turns the movement into a simple leg swing. Slow, held, deliberate extension, 3 full seconds at the end position, is what forces the balance system to work and adapt. Over the last few minutes, you have seen how fall prevention after 70 is not about being careful, moving less, or avoiding challenge. It is about giving the 3 systems that keep you upright: your muscles, your proprioceptive network, and your postural reflexes, the specific signals they need to stay strong and responsive. Heel-to-toe standing rebuilds the micro-correction reflexes that prevent sideways sway. Sit-to-stand without hands builds the functional leg strength most critical at the highest risk moment of the day. Single leg stance trains the neural integration system that catches stumbles before they become falls. Lateral stepping directly targets the hip muscles that most fall prevention programs overlook entirely. And the dynamic balance reach, the most complete of them all, trains the real-time recovery response that is the difference between a stumble and a fall. Each exercise builds on the one before it. Each one addresses a layer of fall risk that the others cannot reach alone. Together, practiced consistently, they represent what the research identifies as the most effective non-pharmaceutical fall prevention strategy available. A fall after 70 is not just a physical event. It changes confidence. It changes independence. It changes how a person moves through the world, often for years. The fear of falling can become as limiting as the fall itself. But the research is equally clear on this. The body responds. The balance system adapts. The reflexes sharpen. At 70, at 75, at 80, the systems that prevent falls remain trainable. They simply need to be trained. You do not have to accept unsteadiness as the price of aging. You have to choose, each day, to give your body the movement it needs to stay confident, stable, and free. Now I would love to hear from you. Have you experienced a fall or a near fall recently? Which of these 5 exercises do you feel your body needs the most right now? Leave a comment with your age and where you are watching from. If this video was helpful, please like it, share it with someone you care about, and subscribe for more guidance created specifically for healthy, independent aging after 70.